Hello, everybody. Thank you so much for joining us today for our webinar. My name is Chris Gao. I'm the Client Development Advisor at Family Source Consultants. And today we have the pleasure to have Brian Rosenberg and Dr. Mark Leonders join us. And Brian is the founder of Gays with Kids, and Dr. Mark Leonders is also known as Dr. L, which is what I call him, as the founder and medical director of Illum Fertility Gay Parents to Be, as well as an advisor to Gays with Kids. So welcome. Please spend a minute introducing yourself to our viewers, please.
Sure. So I guess I'll go first since you mentioned me first.
Yes, please.
I'm Brian, and I've been married to my husband Ferd for more than 30 years. Together, we have 3 kids through adoption and surrogacy. I like to share that I'm the bio parent of our twin girls through surrogacy. And the reason I share this is because I'm also HIV positive. I have been since before I met my husband. And I like to make sure people know that you can become a dad through adoption or surrogacy, a biological parent, if you're living with HIV. 10 years ago, several years into fatherhood, I started Gays with Kids because I wanted to be able to connect with other gay dads. And I also wanted to share my story. Back then, there were scant resources available to help us. And I can tell you, whether it was during my surrogacy journey or my adoption journey, I don't think my husband and I made a single decision feeling really confident about what we were doing. And I hope with Gays with Kids and GWK Academy that we can change that. And that, I don't think anyone should go through their family building journey in the way that we did. I'm delighted to be here. Thanks so much for inviting us, Chris.
Thank you. Thank you so much for sharing, Brian. Dr. L?
I'm Dr. L, and I love Brian. Chris, thank you for having me on. I'm a dad through egg donation and surrogacy. I have a husband. At this point in time, like 70-80% of my practice are men having babies, gays with kids, and so on. And, it's become kind of a passion of mine. As far as the practice, we are a healthcare quality leader according to HRC and have been since 2017. We're fully inclusive and work towards that. We're a practice of 9 doctors. We're a large practice, and we have proven outcomes and proven rates. And I'm always happy to have conversations to get people started. Most recently, I'm very proud to say we authored a book with a social worker, Lisa Schumann, called Building Your Family, because as Brian already mentioned, there's so little you have control over, right? But there are ways to choose your donor. There's ways to choose your surrogacy partners as well as your attorneys. And but we all have to keep it in perspective that this is a lot of work and it's a long timeline. And experience does matter as you choose a clinic to work with and players to work with. So I welcome everybody to the webinar, and let's just get started.
All right, thank you so much for sharing, Dr. L. Yes, today we will be focusing on helping LGBTQ plus intended parents, either you're a single individual or a couple, thinking about achieving parenthood via egg donation and surrogacy. Just because we know, for LGBT, as part of the LGBT community, we know it's challenging for LGBT individuals and couples to have a child, either, biologically, socially, or legally. And today we want to just talk about some of the most commonly asked questions from the community to help people, get a little bit more insight into this. If you are thinking about building your family through surrogacy or egg donation today, you're going to find a lot of helpful information. So first question, Brian, this is a question for you. Can you please just share a little bit about how or where to start for LGBT individuals or couples who are thinking about building their family through surrogacy?
Sure, that's a great question. So I believe it's best to start by getting as educated as possible. And I know that most of us, when we start research, the first thing we do is we go online to Google or we start asking our friends. And in this instance, I'm going to say Google's not always your friend. I can't tell you how many people I've talked to have gone down, Dr. L knows this, rabbit holes at 3 a.m. that they never even needed to worry about. So honestly, as I mentioned, when I was going through my own journey, there were scant resources. So we created GWK Academy. I hope we become known as the very first stop on a gay or queer man's journey to father, because I want to make sure, first of all, that you understand what all your options are. I think that's critically important. Today, I don't know that everyone understands that they have multiple options to parenthood. I want to make sure you understand what they are. And then once you do, that you are as educated as possible before you start speaking with your friends, before you start connecting with family building partners. That way, when you are ready to talk to them, you understand the basics of what you're going to expect it to go through, who you're going to have to work with, etc. And you won't be going down any rabbit holes. And I should add that Dr. L is a part of GWK Academy as a family source consultant. So I'm delighted to have you both. And Dr. L is actually my mentor in the space for all things medically related. So I've done all the work that, you know, intended dads have to do. And so I really tried to make it just so much easier for you. I want you to be educated. And this is the way to do it, as you come to a trusted place, and then you get going and talking to friends and family building partners. But you've got to be talking to the right family building partners as well. Dr. L can tell you how many clinics and agencies there are out there. Way too many. When I was going through this, there were very few. In fact, there were very few that wanted to talk to me as an HIV positive gay man. Today, I think it's overwhelming. And so it's important that you find organizations that are not only experts in their field, but experts more specifically working with the LGBTQ plus community in this.
Yeah, absolutely. I think, Brian, you're 100% right. I also can't tell you how many intended parents I talk to. They'd be like, oh, I've done a lot of research, but still I don't know what to do. I don't know where to start, just because there's so much information on the internet. And so it's so great that we have GWK Academy that is dedicated to helping intended parents basically, find the right or relevant information to them. That's the most important part. You can find as much information as you want on the internet, but it may or may not be relevant to you.
Right. Correct.
Okay, so the next question is for Dr. L. Dr. L, a lot of LGBT parents will ask us, should I use fresh donor or frozen donor? Can you please just share your knowledge about this and talk about the pros and cons of each option and your recommendations?
Absolutely. I mean, the decision tree of whether to use frozen eggs and fresh eggs is complex, does relate back to cost sometimes even now what your insurer covers. That being said, it's important to understand that if you want to have 2 children, you probably need 3 lots of eggs. And 3 lots of eggs is typically going to cost you more or equivalent to using a fresh donor, where you're likely going to get eggs either the same amount as 3 lots, which is going to be 18 to 22 or more. And those eggs haven't been previously cryopreserved. Live birth rates from cryopreserved eggs are very good, and the children are healthy. So that is true. They are a little bit lower than fresh eggs per cycle start, because not every egg that has been cryopreserved survives. Not every fresh egg fertilizes, not every frozen egg fertilizes. So there's this kind of downward attrition curve as we go through the process. So when people kind of start this journey, and let's say they aren't being nudged towards a frozen egg bank by, let's say, a third-party fertility provider, if they want to have 2 kids, I point them towards a fresh donor, because they're going to get more eggs, more options, more likely to have frozen embryos as backup plans or second children, right? If they only want to have 1 baby, frozen eggs is positioned to save them upwards of $15,000 to $20,000. And there are some guarantees within some of these packages that they can utilize. So it has to be personalized. Where we're going in medicine now is personalizing care. And for dads to be, there's a lot of personalization that needs to happen. And, and there's a lot you just don't know. Because what do you know about the menstrual cycle? I've been talking about the menstrual cycle for only almost 30 years now. But It's not something that's part of our gay culture, right?
Not so much.
So, and remember that your team, your surrogacy agency, your doctor, nurses, embryologists, your trusted partners, GWK, your attorney, your escrow agent, everybody wants you to succeed.
Yep.
So we are all on the same page. There's not any competition of like, well, we want this to go longer. The best thing that we can all do is have people be successful in embryo creation and with their first transfer.
Yeah, absolutely. Thank you so much, Dr. L. And my takeaway is it really should be a personalized decision based on how many children you would like to have, and also your insurance situation. Like, as far as I know, in some states, insurance coverage for fresh egg donation is mandated. So, just like talk to your fertility clinic and see what they recommend, and also look into your insurance coverage and make the best decision for yourself.
It's interesting, I'm sorry to interrupt, Chris, that some of the Fortune 500 companies, large employers, are now offering LGBTQ plus inclusive benefits. And sometimes people are actually changing jobs just to have family building benefits. And those employers need to hear that don't offer it, because they all should.
Yeah, exactly. And also this company, or this benefit, Progeny, it's it's an insurance benefit that I believe has to be offered via employment. And even when it comes to Progeny, I have seen different, different plans and different coverages. I have seen some intended parents Progeny policy would only cover frozen eggs, but not fresh, versus a lot of health insurance plans will cover fresh donation, not frozen.
So I think Progeny, Win, Carrot, and Maven are some of the third-party fertility benefits providers out there.
Yeah, absolutely. Okay, so the next question is also for you, Dr. L. And so don't worry, you'll be fine. You have way too much experience to answer these questions. Basically, it'll be a piece of cake. So this is from someone who is HIV positive. So the question is, can HIV positive intended parents use their own sperm? And would the surrogate be at risk of infection? Are there any additional steps the intended parent or the surrogate should take?
Sure. So strong yes, HIV positive people can be fathers through the IVF laboratory, and the risk is essentially absent, but finding a surrogate who's comfortable and educating that surrogate to receive embryos from a sperm source that was HIV positive can be a challenge. So, typically what we do as a practice is we send them to a separate clinic called the Bedford Clinic, which is located in the Boston area. And Dr. Kiesling, who is a PhD Harvard researcher, will actually look at each sperm specimen and clear a specimen, talk to the surrogate, reassure everybody, and then that surrogate then feels comfortable moving forward. It very well may be, Chris, and supported by the literature, Chris, that that's not necessary. But, as I can share, as Brian can share, these women who are willing to carry a baby are taking some risk, and anything we can do to reassure them is worthwhile. So it does add cost to everybody's journey to do that, but it is an absolutely doable path. You might wait a little bit longer for a surrogate, but the surrogate you find knows that you were HIV positive, knows that you went to the ends of the earth to make sure you're not putting them at risk, knows that you really want to be a parent, right? And oftentimes is really personally passionate about helping, our community and somebody who's HIV positive have a baby. So it's actually usually kind of awesome.
Absolutely.
Can I add to that? So I actually did use Dr. Kiesling. I think if I was not the first openly gay man who wanted to become a dad through the SPA program, I was the second. And she's wonderful. And this also comes to most surrogacy agencies that have a lot of experience and passion working with the LGBTQ community. When they're talking to their surrogates in advance, they're already talking to them about working with HIV positive intended dads as well. So hopefully everyone is getting educated before a dad's even being matched with a surrogate.
Exactly. Yeah. Well, Brian, you're 100% correct. And whenever we receive a surrogate candidate's application, we at least at Family Source Consultants, we spent so much time talking to all of them, or each one of them individually, helping them understand the commitment they're about to make, helping them understand their their responsibilities and their rights, and helping them understand the process and how long it takes and what the steps are. And one of the things we discuss is absolutely, are you willing to carry for HIV positive intended parents? And this is a two-way match. It's not just about intended parents' preferences, it's about surrogates' preferences as well. And we'll obviously respect both parties' preferences, and we'll never ever make a match if we don't think it's it's a fit.
Right.
Okay. So when it comes to surrogacy, Brian, just like you said earlier, there are so many things you can't control. As much as we would love to be able to manage everything, or have everything take place as we plan, but it just unfortunately does not always go that way. So sometimes there may be hiccups, and sometimes there may be stress or anxiety throughout this process. Do you have any tips on stress management, like how to find support groups or other intended parents who are going through the same process, for for parents who are in it and are feeling or experiencing some hiccups?
Absolutely. So, and I would say it's common for most of people to experience, for many people to experience various hiccups. Dr. L can talk more about what those are. I mean, I could too, but he's a doctor, so I should let him. And I think it's important that you know up front, honestly, what many of those could be. And that's why we include them in GWK Academy, because I want you to know that people do experience challenges and hiccups, etc., along the way. You're not the first person to experience these. Others before you have done the same thing. And I want you to know what it's like for them to go through it, and how did they get through it. And, people you hear all kinds of things, like they just take a break. They get away from their homes. They go to the mountains. They go to the beach, and they take a break for a week, a month, whatever it is. But I do think it's important to connect with others going through this. And that's why as GWK Academy, when you join, you're not just getting courses, but we also connect you with mentors. We also are building a vibrant community of other dads to be. And I think it's so critically important that you speak to other dads to be. If you don't know any, if you don't have access, you can always ask your providers as well to connect you with those. I know Dr. L would certainly be more than happy to do so. I know FSC would be more than happy to do so. I'm more than happy to do so. So yeah, you should really definitely connect with others. And there are lots of therapists out there. We're beginning to build actually a network of therapists as well that focus on LGBTQ plus family building. So I'd say it's important to get connected with them as well. But you should know, first and foremost, you are by far not the first person to go through whatever it is you're going through. And honestly, it doesn't matter what it is you're going through. Someone else has already done it.
Yeah, absolutely. You're not alone out there. And, as much as we all understand that, every intended parent wants to have a baby as soon as possible, want to achieve that goal, but also make sure you take care of yourself on this journey to parenthood.
Good point.
Okay, so the next question we have is for Dr. L. This is a medical question, because all the intended parents want to make sure they're working with with the best surrogate, with the best candidate, working with someone who will give them the best chance to achieve a healthy pregnancy. We all know once a surrogate is matched with an intended parent, the surrogate will go to a fertility center for a comprehensive medical screening and get clearance. But what about prior to that? How can an intended parent make an initial judgment whether or not someone is a good surrogate candidate for them?
So I think that different agencies work different ways, and I can't speak to exactly what you guys do, Chris, but some agencies introduce surrogates to intended parents prior to medical screening, and some afterwards. Sometimes there's legal done before somebody shows up to my office. So there's lots of different ways to do it. And I want to speak to something that Brian said. The hiccups aren't always medical, by the way. There's a lot of people involved in your journey. Surrogate, her husband, donor, potentially their partner, your clinic. So there's lots of things that come up. Sometimes there's like a national disaster that comes up, right? So, but that being said, you're looking for a surrogate that is in a healthy age range for pregnancy. So in my practice, we use 23 to 42. Why don't we use 21 and 20-year-olds? Because we just find they're just not ready to deal with these complex things, even if they've already had a baby. They have to have already had a baby, and they have to have had a good pregnancy. everybody's probably aware that we want somebody who is in a healthy weight range. Weight too little or too high definitely has an effect on outcomes, everything from miscarriage to pregnancy outcomes. Now we're looking for somebody without concomitant medical problems, in a stable relationship, and also financially stable. Surrogates do get compensated, but we want a surrogate that's doing this because they want to help you have a child and not kind of scraping together to survive and dependent on this to keep their family afloat, right? All those things come into play. So when you're presented with a profile, it's also not unreasonable to think of things that like just make it feel good, like where they live, like maybe it's a convenient location for you, or maybe it's not, right? What they do for work, what their partner does for work. And I think, there's medical screening that confirms a match, but there's a lot of other things that confirm a match. And I always tell my dads that when you're presented a match, let's say by FSC, you're at the top of the list. So if you don't think it's a good match, it's okay to say, we didn't feel it. We'll pass. That surrogate's going to go on to somebody else, and you're going to go on to somebody else. So although you've been waiting 6-8 months and so on, it's a mutual match process. There are a lot of eyes on the case. You're going to trust your attorneys, your nurses, your doctors, your surrogacy matching company, and each other, right? And sometimes, couples aren't always on the same page, and we want to validate those things as well.
Yeah. Yeah, absolutely. I totally agree, Dr. L. And it's a mutual, process. And at Family Source Consultants, before we match intended parent with a surrogate, we always ask, we talk to the intended parents and ask for their criteria and preferences. And not only that, we'll talk to their fertility clinic and get their fertility clinic's criteria as well. So by the time we share a surrogate profile with the intended parent, not only has the surrogate completed the pre-screening already, but also we are only going to share a surrogate that matches the intended parents' criteria and their clinic's criteria on paper. We're never ever going to share a surrogate who is, who doesn't meet the parents or the clinic's requirements.
That's great.
Okay, so next one, Brian, is for you. When we have a child born, and then of course we face this kind of question, are we going to, when are we going to talk about, talk about it with your child, like where do you come from? And I feel like as parents from the LGBT community, sometimes you face judgments from the society. So do you have any tips on gay parenting and when or how to have the conversation with their kids about where they come from?
So I'm not going to give tips on gay parenting per se. I don't position myself as expert there, but I absolutely have advice or thoughts about when and how to tell your kids where you come from. And that is immediately. So let me explain. When Levi, our oldest, who is now 15 and as big as me, maybe bigger, when we found out about him, he was 3 days old. We brought him home from the hospital 2 days later. And within 3 or 4 days, my husband had written a story for Levi that we read to him every single night, putting him to sleep for the first 3 years of his life. And it was how we became a family. Thank you, Dr. L. It was how we became a family. And it talked about his story in ways that we were comfortable communicating with an infant. This was the story he heard. And by the time he was 3 years old, he was repeating it ad nauseum. So in ways that were comfortable and made sense to him. And as he grew, we explained more and more. Then when his sisters joined us 17 months later, Ferd went and wrote another very short, sweet story about how we grew our family. And then Levi would come into the bedroom with us, and we read that, and we said to the girls every night for the first couple of years of their lives. And so by the time they were talking, they already understood the real basics. And I think, we should be as honest and open about this as straight families are. And so there's no surprises. Kids understand it. They get it. As long as you're not afraid or embarrassed to tell the story. And if you're becoming parents, you best not be. Then you just share openly and honestly and language that's appropriate for them.
Yeah. Wow. Thank you. Thank you so much for sharing, Brian. And So next, we are going to take a couple, live questions. As we spoke, some viewers have already typed out their live questions, and I'm just, looking at the list. But first, Brian, I wanted you to hear this, and we got a viewer saying, "Thank you so much for sharing your personal stories, Brian. It's very encouraging." So yeah, thank you so much for sharing. Okay, so I am picking this question because I feel like I hear it all the time: single embryo transfer or double embryo transfer. So this viewer was saying, they've done the research and they've talked to fertility clinic and know that single embryo transfer is not recommended these days. But Dr. L, they want to hear it from you. What are the risks from a double embryo transfer?
Sure. I think it's important for everybody to understand that thankfully IVF success rates have incrementally increased year over year over year.
Mm-hmm.
And back in 2015, 16, 17, for all patients, we were generating a lot of twin and triplet pregnancies. And what we learned is that those multiple pregnancies are associated with higher risk for lifelong disabilities for those kids, right? Everything from autism, developmental delay, to simply just being born prematurely, which is a real risk for a lifelong disability, as well as major birth defects increase. So it is so expensive to have a third-party journey. On the other side, if your child has a lifelong disability, you're going to far outstrip those costs. Surrogates also do get paid more if they're pregnant with two. And as a practice, and I'm not aware of many practices that will go against the American Society for Reproductive Medicine guidelines, meaning using donated eggs, usually chromosomally normal, into a gestational carrier, only transfer one for the well-being of the children and the surrogate. Remember, the surrogate has an increased risk for high blood pressure, diabetes, C-section, and associated risks for that. So it does always pull at my heartstrings. And I would like it if I had kind of a magic crystal wand, a magic wand to say, this is going to be a good twin pregnancy. But human beings were designed for one baby at a time. And that is the safest pregnancy for your children and the surrogate. So, we've really moved as a field to one, and that increases the financial burden for a lot of people. I think it's important. I'm sure at FSC, you guys have a plan for people for sibling journeys. But it's really the safest thing you can do for your family. All bets are sometimes off, even if you have one pregnancy, that everything's going to be fine, right? But it's just, we talk about a 15% to 20% risk in a twin pregnancy of a lifelong disability. So that's 1 out of 7, 1 out of 5. And you're probably not going to take that risk for your children.
Exactly. Yeah. Wow. Thank you. Thank you so much for sharing and sharing your thoughts and as well as the statistics, Dr. L. And another question is actually kind of related. And the viewer is asking, what kind of testing options are there to help me basically increase the success? Like Dr. L, would you like to address this?
As far as like success rates, I think it's important that everybody aware there's something called SART.org. You can go in and look at your clinic and you can plug in filter, gestational carrier, egg donor, day 5 embryo, PGT, and get the results. And you can even, look across the country at different rates. Things that you can do, don't smoke, make sure your sperm isn't broken, don't drink too much, work towards a healthy weight, think about your own exposures to, lifestyle choices that might affect your sperm quality. You're only going to make embryos once, right? You want to look for a donor with an excellent family history. You're not getting her, you're getting her previous 3 to 5 generations. You want to make sure you have a donor that passes mental health screening, right? A lot of things like bipolar disease, depression, schizophrenia doesn't show up till somebody's in their 20s, and it's a complex genetic issue. As far as success-wise, your donor is important, but your surrogate's important as well. What's their pregnancy history, right? And when's the last time they were pregnant, right? And do they have a history of different complications in pregnancy? And remember, we said this already, your trusted providers are all going to also be doing the same thing. And it is true that I have intended parents that sometimes feel paralyzed about all the things to worry about, and my arms kind of want to go around them because we do have that for them.
Yeah.
But it's a roller coaster, and it's got some sharp turns.
Mm-hmm. Yeah, absolutely. Thank you. Thank you so much for sharing, Dr. L. And the next question, I think, well, actually, either of you could answer. This is a question from a viewer who is asking, should I focus on creating embryos first, or should I start the matching process? Well, basically, simultaneously, just because it takes some time to be matched with a surrogate.
I can take that, and then I'll let Brian comment. It depends on you, right? And it depends on your financial competence. Like, I think everybody has to understand, let's say it's $200,000 to have one baby. That's money due over usually a period of 1.5 to 2 years, right? And if you can bucket that all out and you can do everything simultaneously, kudos to you. But a lot of people can't. It ends up being like 3 years. But I think that I like to take this whole big team that you're going to build and break it into pieces. So first thing we need to do is focus on you. If you're a partner, do you both have sperm? Are your genetics done? Do you both want to be genetic fathers, right? And then if you're working with a surrogacy agency that has a 12-month or 15-month match time, well, go ahead and sign with them. That's done, and then look for your donor. If you're working with FSC that has a shorter match time, we all know that, I mean, you can speak to this, Chris, that the surrogates want to know you have embryos sometimes before they do the mutual match. So go ahead and find your donor and make your embryos first, and then sign once you're ready to go. On the clinic side, you don't have to sign up with us. We're just like always working. But on the surrogacy agency side, you do usually have to put down a retainer, and that varies widely across the industry. So you have to think about your family building goals and your timeline, sometimes your own age. I know we talk about the woman's biological clock all the time, but I think we have biological clocks too. As I'm parenting, young children moving into my 6th decade, it's work, right? This is the hardest job you'll ever love. Brian, what are your thoughts on this?
I agree completely. I think it's really important to. I always tell people, Doctor, you're my mentor in this. So I always start by saying this is a medical journey first and foremost. So you need to get that part cleared. But as you said, Dr. L, different surrogacy agencies. I mean, I see a range in offerings. Some surrogacy agencies take nothing, no deposits up front. Some are offering no wait times. Others are offering 12 to 18 months. So it really depends on the partners that you choose that makes the most sense for you. But certainly I always say you should start with a doctor, but if you, as Dr. L said, if you can afford to do everything at once and you just want to get going, then there's no reason not to start with both at the same time.
Remember, you have to have the bandwidth to do everything at once as well.
Yeah.
I mean, honestly, it becomes a full-time job.
Mm-hmm.
But no matter what path to fatherhood you're going under, actually, it's almost like a full-time job. In fact, my husband was not working when we were creating our family. And I used to say that was his full-time job. And
it will remain your full-time job.
Sure will, for at least 18 years, right?
Well, then they come home after college. So I think it's longer than that.
Okay, well, we do have more questions from the viewers, but unfortunately we're not going to be able to cover all of them, so I'm just going to do one more. And for the rest of the questions, viewers, if we didn't get to cover your questions today, please feel free to reach out to us, reach out to Dr. L at Illum Fertility, reach out to Brian at Gays with Kids. But the last question we're going to address today is, so someone said, would you recommend finding a surrogate on your own and go through an independent journey?
So you want me to take that one, Dr. L?
Well, I think we should both take that one.
You go first is what I meant, and I'll add to it because you can talk.
So independent journeys are becoming more frequent in my office as the cost for surrogacy has gone up and up and up. The other part of the story is you don't know what you don't know. And there are some lovely people out there who want to really be a surrogate, and they may or may not want to work with an agency. Understand that many of the clinics, mine including, are going to require some agency support because an independent surrogate still needs financial background check, criminal background check for her and her partner. They need a lawyer. They need escrow. They need appointments. They need their insurance check. They need to know, they need travel. And you don't even know the basics of the things to look for, right? And so you're going to want some agency support. So if you want to try an independent journey, I will tell you it is going to be exhausting. And I'll let Brian talk, but Chris, you can probably talk about the fact that you're throwing out a really wide net and coming up with very few fish. I don't want to say that. Very few young ladies who want to carry a pregnancy in your net, right? Because not just at a first level screening, you lose a lot of people. So typically, if there's 100 women who want to be a surrogate, you end up with 3, right? And that's a huge drop off.
Absolutely.
So, Brian, you have a different perspective on this as well. So what are your thoughts?
So it's funny this discussion came up because today we just launched an independent surrogacy journey part of Gays with Kids because, like Dr. L said, it's becoming more and more important and expensive. And I realize, for some people, when they hear the price tag, what we quote people is somewhere between $140,000 to $220,000. And for some people, that financial burden is just more than they can bear. And yet they still want to become parents, biological parents, and they should be able to. So I believe that, again, it's all about being educated. Check out and we take you through everything that's involved. But so 2 things. Number one is, I don't think anyone should be going through a completely independent journey, completely on their own. You need support. In fact, we have a couple of consultants that, or even I know some surrogacy agencies where they offer an hour-long, they offer sort of consulting by the hour. You just can't possibly do this alone. I'll tell you, and the people that want to undertake an independent surrogacy journey, I think they share these 2 traits. Number one, they've got the time. And we were joking earlier about the time. I mean, this is truly a full-time job. Number 2 is they all share what I would say type A personalities, right? They need and want to control things. I'll tell you the truth. Anyone I know who's gone to an independent journey completely on their own, today they own surrogacy agencies. So I don't know most people. I really don't. But if you really want to do it by getting as educated as possible. So check out our new independent surrogacy journey section at Gays with Kids, GWK Academy.
Yeah, thank you both for sharing your insight. And I wanted to add a little bit about that, to that as well. And I would say, obviously, this is a personal question, and if you feel like this is something that is the best option for you, it's worth considering. But I would still, just like Dr. L and Brian recommended, highly recommend that you still somehow work with a professional to basically navigate through this journey, because I have certainly heard and seen stories where intended parents work with a really good friend going through an independent journey, but things didn't turn out well, or there are just things that didn't think about communicating up front, and then when it happened, it just created such chaos. And unfortunately, there was that one case that I'm aware of. They had to drop the surrogate, and their friendship didn't survive, unfortunately. But I would say, I'm sure some other agencies will offer the same as well, but Family Source Consultants offer a facilitation option. So that means if you have your own surrogate, if you find your own surrogate, we'll still be able to help you with the case management and share all of the resources we have. We just won't be matching you with a new surrogate, but you'll be surprised how many times when we help intended parents with a facilitation journey, when we talk to them about certain things, they'd be like, oh, we never thought about this. We haven't thought about this yet. We haven't talked about it yet. We between the intended parents, we haven't even talked about it yet. So of course we haven't talked about it with the surrogate. So there are absolutely a lot of things to think about. It is not as straightforward as, okay, you are, we get along with you. You're not infertile. You have golden history of pregnancy and deliveries, and you're going to be our surrogate. It's a lot more complicated than that. But again, this is obviously a personal question, and talk to your fertility center, talk to the professionals, and see what is the best option for you. Okay. I think, unfortunately, we're going to have to, close our session today. But before we all go, any final thoughts or tips for our viewers out there who are, part of the LGBT community, considering building their family through surrogacy and egg donation? Dr. L, would you like to start?
Um, kudos to you. You can do it. It's going to take time. It's
Yeah.
going to be work, but it will be the greatest joy in your life. And just take it step by step, and don't feel overwhelmed, and reach out for help.
Thank you. Thank you. Brian?
Sure. Thanks, Chris. Thanks for having me again. This has been a lot of fun. Here's what I'll say. Anyone I know who wanted to become a parent, any of my gay friends, any other people I know out there, they're parents today. So it might not happen as straightforward as you'd like or on the timeline that you'd like, but just keep going towards it. It will happen. I promise you. Anyone who really wants to make it happen, it will happen for you as well. Get as educated as possible. I'd love to help you out on DWK Academy. If you do come through from this webinar, let me know. But yeah, I just say, just keep the eye on the prize, and it will happen for you as well.
Yeah, absolutely. I wanted to say to the intended parents out there as well, stay hopeful. And this is a long and complicated process, so it may not be like, okay, you're ready to start and you have a baby in 12 months. It's not as straightforward as that. But there are so many professionals out there who care about you, who want to help you become parents, and just reach out and talk to someone, and I'm sure you will become a parent one day. Okay, I think this is all today. Thank you so much for joining our webinar today, Dr. Al and Brian, and also thank you so much for watching our webinar today. And if you do have any questions that we didn't get to cover, please don't hesitate to reach out to Family Source Consultants, Illum Fertility, Gates with Kids, and we're all happy to help answer any questions you may have. Okay?
Bye, everybody.
Hey, everybody.
Thank you.